Good afternoon or good evening. What time does evening officially start? 6 o'clock? What time is good evening? 5? All right. Good evening, everyone. Please take your seats. We're excited to get started. A lot to cover tonight. Welcome to the annual community update. We're grateful that you all came in person. Good to see some faces we haven't seen in a long time. So thank you for being here. So we want to get started. If you didn't, I am Dr. Charnel Hawkins, and I get to serve as the President and CEO of the Urban League of Rochester. And it is my honor to be with you all today to talk about the RASE report. But first of all, I want to acknowledge and thank Mayor Evans for his leadership, and of course, our County Executive, Adam Bello. The two of them have continued to champion the RASE report. And it was, in fact, that the two of them appointed the Urban League to take the RASE Commission to the next phase, which is advancing the recommendation. So we're grateful to them for their leadership, and we will hear from them shortly. I also want to acknowledge Dr. Candace. Yes, they deserve a round of applause. I'd also like to acknowledge Dr. Candace Lucas, who is with the Urban League. I don't see where there she is. Dr. Lucas, I didn't see you. But Dr. Lucas leads the Equity and Advocacy Department at the Urban League of Rochester, and she champions all of the race work that we do. And she and her team have worked hard to make sure that we advance the recommendation and works in partnership with the facilitators that you'll hear from today or see today, and also with the community members. So thank you, Dr. Lucas, for your leadership. And I also want to shout out Audrey, who's in the back. Audrey's also on the Equity and Advocacy team, and she's working technology, jack of all trades. As I've already mentioned, I'm Dr. Charnel Hawkins, President and CEO of the Urban League of Rochester, and this is our annual report out to the community on the Commission on RASE. And I want to thank you all. I also want to acknowledge the City School District. Thank you to Dr. Peluso and his team. Let's acknowledge them and give them a round of applause for their support in the advancing the RASE recommendations. Just really quickly, if you didn't know, the mission of the Urban League of Rochester is to enable African Americans, Latinx, anyone that has been disadvantaged to help them secure economic security, self-reliance, also power, parity, and civil rights. And we do that in 4 ways. I won't get into reading all of them, but it is our role to serve this community, and we've been doing that for almost 6 decades. In fact, next year, we'll be celebrating 60 years of serving Rochester. So we hope you celebrate with us. And I just want to quickly just let you know what our focus is this year. We are part of the National Urban League. We're one of 92 affiliates. And our focus this year, our strategy is a D3 strategy, really simple. Defend democracy, demand diversity, and defeat poverty. And the work that we're doing, yes, absolutely. We're really proud of that. And how we do that work is, one, we ensure that our community is educated on the importance of voting. We also are championing the John Lewis Voting Rights Act. We are championing that, and we hope that you will too. We also want to make sure our community members understand their role in helping to educate folks on their right to vote. As far as our work in demanding diversity, you'll hear that because the RASE work that we do is absolutely prioritizing diversity. And so I'm excited about sharing more and you hearing more about that. And then our work to defeat poverty, whether it be making sure that individuals have a connection to good jobs, home ownership. That is the work we do. We also are a partner to not just the Rochester City School District, but other school districts as well. And we serve about 1,300 children. And so we're making sure that they have a good start to advancing their careers, and also making sure that they understand what's needed to have a pathway to economic self-reliance and also upward mobility. And that is the work that we're doing at the Urban League. So I wanted to share that with you. I also wanted to remind you that the Urban League as part of the National Urban League, we have a report every year, and this year's State of Black America is something to be read. It takes us back 60 years to the 1964 Civil Rights Act. And in the report, you'll learn more about the Equality Index and how African Americans are faring with their white counterparts. You'll learn more about what's happening and how the Biden administration has supported African Americans. And so if you get an opportunity, please read the State of Black America report, and all you need to do is go to stateofblackamerica.org. So I want to thank you for taking the time to learn more about the Urban League of Rochester. And without further ado, I want to make sure that we make room for our Honorable County Executive, Adam Bello.
All right, good afternoon or good evening. It's just a pleasure to be with all of you here today, and Dr. Hawkins, I can't thank you enough and the Urban League and your team for all of the work that you have done on race and developing the carts and fighting for equity throughout our community. You stepped up to meet the challenge here when it came to the Race Commission work and the carts, but that's really just one piece of the many ways that you're impacting this community and uplifting this community. So thank you for your partnership, your friendship, and all of your work. Let's give Dr. Hawkins a round of applause. I, of course, also would like to acknowledge my partner in government, none of this can be done alone, but I want to acknowledge the mayor, Mayor Malik Evans. This is truly one of the greatest strengths we have in accomplishing the goals here from the race report is collaboration, and it requires an intense amount of collaboration between the county, the city, and our community partners, and we can't do this work alone. And I want to thank the mayor for his partnership and his leadership. I also want to acknowledge other leaders who we work so closely with. I see the Rochester City School District Superintendent Peluso, thank you. President of the school district, Cynthia Elliott. I saw President Elliott here, so thank you. Your partnership is critical to the success as well. I also want to acknowledge from the county legislature here today, the majority leader of the county legislature, Mike Udelson. Thank you, Leader Udelson, and legislators Lystra McCoy and Sue Hugh Smith. Thank you as well. And of course, extending beyond the leadership of these organizations, I do also want to acknowledge and thank the staff that works tirelessly at every level. You are working together from the Urban League to Monroe County, the City of Rochester, the Rochester City School District. You are all making direct impacts on the lives of our residents. And while us leaders can be up here and speak about the work in a high level and speak to things up here, it's really the teams that are really working, rolling up their sleeves and getting this work done, and I want to thank them. You know, this year marks our third annual community update since we undertook the historic work of the Race Commission. Each year we continue to build on successes. We move our city and our county and our community ever closer to achieving equity. The RACE report is a critical tool that guides and shapes the equity work that we do in both city and county government. And we remain incredibly grateful to the dozens of community members who gave their time and talent to contribute to the report and to help shape the future of our community, and the time and effort that they put into creating this report was really just remarkable. And so I'm really honored to be here today recommitting Monroe County to this work. We are led in our work here at the county by our Chief Diversity Officer, David Scott, so I'd like to acknowledge David Scott and his team. And David is supported by our entire senior management team, and Monroe County is happy to work with our partners to make great strides. This work is important, but it's also difficult, and it requires commitment, and it requires dedication. The work we must do to dismantle inequitable structures, to rethink and rebuild systems, and to ensure our policies are inclusive, welcoming, and developed through a lens of equity take more than a year. This takes more than a year, it takes more than 2 years or 3 years. This is a lifetime of work. This is work that needs to continue, and really that's why I'm so grateful to the Urban League and Dr. Hawkins, because when this report was created by all those dozens of hardworking people who really committed themselves a few years ago, we knew that in order for this to be successful, that it can't be a report that's going to sit on a shelf. It needs to live. It needs to be a living document that we continue to work towards, to look at the recommendations, figure out how to implement the recommendations, to invite the community in to be part of the implementation of those recommendations. And we knew that it couldn't just happen all at once, that this was going to take a long time. It's going to take several years. Here we are at our third community report to be able to talk about the progress that we've been making. So in the room today, we have members of the Community Advancing Recommendation Teams, the CART teams. These are members of our community who came together to make sure that, of course, we continue to implement the work here. This is essential collaboration. Government has to work in partnership. The mayor and I can't do all of this work by ourselves. So you are leaders, the CART team, you are leaders here in our community, in the fields that you have lived experiences, and you have a passion for this. You have a passion for this work, and you have a passion to leave this community better than you found it, and that's a really, I think, noble thing. So you represent community-based organizations, institutions of higher learning, private businesses, communities of faith, and you are joined together by a charge to make positive and lasting change. So again, thank you for the work that you're doing. I'm grateful for the time, energy, and commitment that you have put into this, and I will forever be grateful for your partnership. Thank you.
Thank you, County Executive Bello. We are grateful for the partnership with the county, but you can't do it alone. And so the counterpart is the city of Rochester, and we are grateful for our very own Honorable Mayor Malik D. Evans.
Thank you, Dr. Hawkins. Thank you, County Executive Bello. Great to be here, and also great to see our elected officials that are here. I know that the county executive already mentioned our school board president. Education is such an important component of this, and I know probably Dr. Peluso will be joining soon, but it's great to see President Cynthia Elliott here. I saw William Burgess just walked in from the county ledge, and of course I know he recognized Sue Hughes Smith, Mike Butelson, and Lystra McCoy. So thank you all for being here. I also want to just thank the city staff that is here. City staff, if you can just wave your hand. You got a good number of city staff members that are here, including Director of Special Projects and Educational Initiatives, Lily Ruiz, our fire folks here, our fire chief, and also our deputy chief. They're here sitting, they're behaving, they're sitting next to each other, but, right? Yeah, I'm watching. Director of Violence Prevention Services, Victor Saunders. You're going to hear from our Chief Diversity Officer, Dan Butler, soon. John Brock, Special Assistant to the Mayor, is hiding back there somewhere. And I don't know if I missed any other city staff that's here. And I see City Council staff is also here as well. So that tells you how important this is. I see staff from Jeremy Cooney's office. I see staff from Demond Meeks' office, right? I saw someone from Demond Meeks. Yep, there she is, Vivica Smith. So this is important, and I think it's important that I call you all out because these recommendations go beyond just the city, and we understood that very, very clearly. I was in a very unique position because when I came in 2020, the report was completed. The report was done. And people were wondering, and I remember Dr. Hawkins calling me. I said, Dr. Hawkins, I haven't even found the bathroom yet. I know where the bathroom is at City Hall. And she's like, what are you going to do about advancing it? I said, well, we got to get together to see how we can make sure that these recommendations are advanced. So it's important. The county executive is right on. We spent a lot of time together, and we said, what can we do to make sure that this report kind of lives in the community? Because if you look at the report, there are things that are county-specific, and there are things that are city-specific. But some of the items in the report go beyond the city and county and encapsulate the entire community. So we needed an organization like the Urban League that could help bring people together to talk about the various pieces of the report that go beyond the city and county. But we're here tonight about where the city has gone so far with the recommendations that we've committed to. and we've embraced every recommendation that is appropriate or apropos to the city. We've embraced all those recommendations, and you'll hear from, I believe, is Dan or Lily? Dan's going to do, I think, is going to give the update. You'll hear from Dan where we are with some of those things that we are doing to advance some of the RASE recommendations. They've been great recommendations. We know that this is a marathon and not a sprint, and we hope to continue to advance these recommendations as we continue to work together. You will also often hear me make clear that collaboration is very important. My former mayor and mentor, Bill Johnson, he would say this during his tenure. It's hard to believe he was in office. He ended his tenure 20 years ago, but he would say this during his 12-year term, that it's we, not me. It's we, not me. And there is no way that a mayor of the city of Rochester has some type of magic wand where they can say I. And I would tell you to be wary of people that say I. It's we. And you know, in French, we is yes. And it's yes, it's all of us working collectively to get this stuff done. We can't do this by ourselves. We can't expect the school district to do it by themselves. We can't expect the city or county to do it by itself. It's all of us working collectively to be able to do this. I mean, there were 200 RASE recommendations that are there that we all are working towards. It's important to have these events to take stock and see where we are and see what work still needs to be done. I lastly want to thank the CART, the recommendations team. No one's paying you any money. You're taking time out of your busy schedules because you believe in this work, and you don't want to see a report just be a shelf document that you use to stack up or hold books or put under a table. The only way that we can make sure that we're doing what we say we're going to do is by meeting regularly, connecting in on these things, and making sure that we are being connected with a lot of the recommendations. I'm happy to say, and you'll hear from the city side in terms of reports, some of those recommendations have been actionable items that are actually have dollars assigned to them and have been in our budget. Our departments are all aware of the RASE recommendations and how they apply. Our website maps what the recommendation was and what section of the RASE report it maps to and any associated dollar amounts that are associated with it. We still have a lot more work to do, but we are making great progress, and a lot of that progress is being made because of people like you. So again, I want to thank the Urban League and all of you for taking time out of your busy schedule on a Wednesday evening to come out and support the RASE Commission and the hard work that's been taking place. So thank you all for coming out tonight, and I look forward to your continued support as we continue this journey to improving our overall community. Thank you.
Thank you, Mayor Evans, and I just want to echo what the mayor said. We cannot do this work alone. It certainly takes a community to do this work, so thank you all for continuing to champion advancing the RASE recommendations. So, Dr. Lucas, let me know about this part, or can I move on? Okay. I want to, as you've already heard, the county executive and the mayor acknowledge the CARTs, but we formally need to acknowledge the leaders that raised their hand, that said we, or said yes, and certainly said that I will take the lead and be the DNA for championing the RASE recommendations. They certainly are the ones that drive the work being done. They also act as leaders to make sure that other community members are engaged. They take their own notes. They send that information. It's a lot of work that they're not being paid for, and we want to acknowledge them and recognize them for their great work. So before I call out their names, please certainly give all the CART facilitators a round of applause for their leadership. We certainly could not do this work without them, and we thank them for taking on the leadership role. And so I also want to acknowledge quickly Liliana Ruiz. I heard the mayor recognize her, and also John Brock, because they have been acting in the background to champion this work. So thank you both for your leadership. Yes. So for the Business and Development and Job Creation CART, we'd like to acknowledge Ted Polano and Kimberly Mitchell for their leadership. And if all of the CART leaders can come to the front, we're going to take a picture along with the mayor and county exec. But I know you folks don't like to come to the front, but we need you at the front. You're leading the work. For the criminal justice and policing CART, Cynthia Harriet and Dr. Rashid Muhammad are facilitators of those CARTs. If they could come to the front of the room, please. For the education CART, Joseph Fargnoli, if you could come to the front of the room, please. Thank you very much. For the healthcare CART, Jackie Dozier and Dr. Thomas Green. Just want to make room for folks so we can just come on up together. And we can give them a hand while they're coming up. Like, I think they deserve that. For the housing CART, Lori Mahoney and Ron Washington. Human and social services CARTs, Dr. Sandra Katz, and I know she's unable to make it here, but we have someone accepting on her behalf. For the mental health and addiction services CART, Ms. Regina Bradley, thank you for acting as a facilitator. And our last CART, but certainly not the least important, is our older adults CART, and we want to thank Martha Hope and Phyllis Jackson. And I know Phyllis Jackson can't be here today, and we'll make sure that she gets her certificate. But we want to acknowledge and thank all of the CART leaders. Thank you for your hard work. Thank you for championing the RASE recommendations. And also thank you for your commitment to advancing the work and volunteering your service to our city and our county. And so please, if you could take a picture with the mayor, the county executive.
Right. Well, thank you so much, everybody, and facilitators for doing that. I know that was a little difficult, having to come all the way up here, but it's important that we acknowledge you and we give you your roses while you're here. Good evening, everyone. Good evening, everyone. Good evening. All right, there we go. There we go. I'm Dr. Candace Lucas. I'm the Senior Vice President of Equity and Advocacy at the Urban League of Rochester. And I, too, just want to thank everyone for joining us for this third annual community update on the RASE recommendations. Before I jump in, I just want to remind you that we do have refreshments in the back, courtesy of Northern NOLA. So if you have not gotten any refreshments yet, I encourage you to do so. I'm hearing that they are delicious. Wait, yes? Okay, right? So please give it up to Northern NOLA, one of our local, small, minority-owned businesses. Chris, if you want to wave at everybody. All right. So please, please, please do that. I know the mayor and the county executive had to rush out to another event, but I do want to thank them as well for their words and their recommitment to this work. They have been championing this initiative since we've been doing it, and they have been prioritizing the work of the RASE Commission. So just as a quick refresher, and on the RASE Commission, and at the expense of maybe being a little bit redundant, but I think it's important, just to remind everyone, the Commission on Racial and Structural Equity, known as RASE for short, was established in June of 2020 by then Mayor Lovely Warren and County Executive Adam Bello. And we're so grateful to Mayor Evans for picking up the mantle of this when he began his term and committing his administration to continuing to implement the over 200 recommendations that are outlined in the commission report. From its inception, the commission was meant to be a community-led and community-involved initiative. 13 of the original 21 commissioners were selected by a panel of community members. And actually, some of them are in the room today, so I'd love if you waved your hand. I see Dr. Stephanie Townsend, I see Louis Ormecchia. Are there any other original commissioners that I'm just not seeing right now? But thank you both for continuing to be part of this work. Please give them a round of applause. Because they did some serious work. So 13 were selected by a community panel, 8 were selected by the mayor and the county executive. And as the commission was seated in August of 2020, they were charged to do 3 things. 1 was to inventory and assess current local laws and policies that either promote or are intended to eliminate institutional and structural biases, racism, and inequities in the city of Rochester and Monroe County. 2, they were to provide recommendations to enhance current local laws and policies to increase their effectiveness and or sunset local laws and policies that were ineffective and no longer applicable. And 3, provide recommendations on any new local laws and policies to address identified gaps. So really, in a nutshell, the intent of the commission was to examine and develop policies and legislation to overcome systemic and institutional inequities and racism in Rochester and Monroe County. The commission, along with hundreds of community members, worked diligently for over 6 months, looking at local laws, codes, regulations, policies across 9 sectors. Those sectors included business development, criminal justice, education, job creation, healthcare, housing, human and social services, mental health and addiction services, and policing. In addition to reviewing the legislation, they examined data from a wide variety of official sources, including the U.S. Census Bureau, New York State Education Department, the Department of Criminal Justice Services, Small Business Administration, and the Centers for Disease Control, as well as local sources like Common Ground Health reports and reports from the Monroe County Department of Human Services. Community engagement was also a high priority for the commissioners. They organized virtual town halls, distributed surveys, interviewed community members that were impacted by these focus areas. They took bus tours to affected communities and spoke with residents and business owners. They held discussions with incarcerated youth, high school students, and formerly incarcerated men, to name a few. In March of 2021, when they delivered their 200 recommendations to the mayor and county executive, they said, while they did not find any overt laws in the city and county which created and sustained racist policies, they did find practices and conditions where diversity of race, ethnicity, and gender are nearly non-existent, where people of color are unable to fully participate and are implicitly or explicitly excluded from opportunities that could enhance their economic, social, and mental health, and where people of color are denied the opportunity to participate in the rulemaking and decision-making that shapes their lives from birth to death. At the release of the report, the commissioners knew the work they were putting forward was not going to be easy. They knew that it would take the efforts of each and every one of us to bring about the type of change Monroe County needed to become an equitable and just community. To that end, they challenged the mayor and the county executive to ensure that their work did not go in vain. They, in turn, called for 3 things. 1, they called for the establishment of a successor organization that would monitor the city and the county's implementation of the recommendations. Hence, the Urban League was contracted in 2022 to be that successor organization. 2, they called for an annual reporting to the community on the status of the recommendations to ensure transparency and accountability. So again, thank you for joining us for this 3rd annual update. And 3, they charged to engage the broader community in the implementation of those recommendations which go beyond the scope and authority of the city and the county governments. So again, they knew that this was broader than what the mayor and the county executive could do. They knew there was a place that every one of us could play. And so they charged to do that. And the Urban League has taken that up with the implementation of the carts and working across the community with other partners. So this evening's annual community update is in direct response to the requests of the RASE commissioners. This evening, you will hear a more in-depth discussion from representatives from the City of Rochester and the County of Monroe on what actions they have taken on over 2023 to put forward the recommendations. You'll also hear from our community facilitators, those facilitators of the carts, who have taken leadership roles to help implement some of the work, and they will share what you can do to get involved in moving this forward. And we want to thank all of the dedicated community members who worked with the commission originally to develop the recommendations and those who have stepped up to help implement the recommendations. As a community, this is our chance to shape Greater Rochester into what we know it can be. The RASE report is our blueprint, and we each have a responsibility to assist in improving our working and living conditions. So this evening's community report is being live streamed on the library's YouTube channel, and it's also being recorded, and it will be posted for future viewing. If anybody is watching, it's not too late to tell more friends and family and neighbors to join in and hear what's going on tonight, because the intent is for this to be public, it is to be transparent, it is to make sure that our entire community knows the work that is happening on their behalf. So with that, I want to turn it over to Dan Butler, the Chief Equity Officer at the City of Rochester, who will be followed by David Scott, the Chief Diversity Officer for the County of Monroe. They're going to highlight some of the major initiatives from the work that was done in 2023. Online, currently at rockraise.com, is the update from 2022 and previously. So people can definitely go back and see what has been happening each year. They're just going to give an update for this year. At your tables, there are index cards. So if you have any questions, we ask that you please write them on the index cards. We will collect them and have time for Q&A afterwards. And I want to thank Dan and David, and invite Dan to come up. And I apologize, I forgot to roll the slides while I was talking, but y'all got what I said, right?
Just hit this. Just hit this. Just hit this right here. Okay. Good evening, everyone. It's good to see everyone tonight. I'm excited to be here. It's good to see a full house, and the food is good. So I'm here. It's great to see my counterpart, David Scott, who's been a great help to me. It's good to see him here. I think I want to give a shout out to Liliana Ruiz, who's been working very closely with me. I happen to see my supervisor, Dr. Rose Nichols, in the back, along with my good friend, Fernand Sapiro. I thought I saw him. He's way in the back, but just good to see both of them on this evening. So we're just going to give our report, being, as you can see, our business development. We have the MWBE conference that's coming up. First of all, we had our recommendation one was to host an annual joint city-county MWBE business development fair, which can, one, offer training on certification and contracting requirements. 1B, publicize forthcoming contract work, suitable for small businesses and MWBEs. 1C, to promote local and regional MWBE businesses. D, provide matchmaking for MWBE vendors and subcontractors with municipal agencies, prime contractors, and major local purchases. City of Rochester hosted the first upstate New York MWBE conference just last year, March 2023. This three-day event brought together MWBE businesses from the 4 upstate New York regions, being the Finger Lakes, Western New York, Central New York, and Southern Tier. Our next one will be May 8th through the 10th, and that's coming up quickly. We're really excited about moving forward in the work of business development and with the MWBE conference. Also, with education, we're looking at increasing cultural competency. Recommendation: the need for increased cultural competency and responsiveness along with anti-racist practices was identified for several systems at both the city and county levels. 1, purchase cultural responsive libraries for each of the art centers. Book nooks have been installed in the city's art centers and in the teen center in the Loretta C. Scott Center for Human Services at 57 St. Paul Street. The books were published for youth in grades K through 12 in the art centers and 7 through 12 in the teen centers. The books cover varied interests and are culturally responsive to all age groups. Youth will have the option to read books on site or to take a book home to read and return to the site. In addition, we had undoing racism workshops for city, county, and the CART members from the People's Institute for Survival and Beyond out of New Orleans, Louisiana. We had 120 people participated in the workshops. I participated in all 4 workshops. We covered a lot. I see Laurie smiling over here, where we're able to confront racist systems, policies, what racial caste system really is about, and how we can work together to organize to begin to pull down these systems, not only looking internally, but looking externally. Healthcare, Healthy Food Accessibility Initiative. Key issue 3, impacting social determinants of health to increase racial health equity. This particular initiative focuses on the city's efforts to expand access to nutritious foods for city residents and living in areas with a shortage of food options or food deserts. The city of Rochester will invest $5 million in American Rescue Plan Act or ARPA funds to increase the availability of healthy foods to city. The HFA entails of a community-wide food system plan consultant, innovative food models, and healthy grocer campaign. Can everyone hear me fine? Hmm? Yeah, it's really little. Yeah, that's why I'm looking this way. It's really little. Yes, I'm past a certain age. So yeah, well, thank you so much. You're going to try to help me out here so I can look at everybody. But everyone can hear me fine? Okay, thank you.
Oh, yeah, but now it did that, so that didn't work. Nope, let's see, that didn't work.
Well,
Hang
is
on.
it all right if is anyone distracted from the way I'm doing it? Everybody's fine?
When you move away from the mic, then.
Okay, we want to make sure you hear me. Let me go back and we'll be fine. Just did health care. Yes. All right, there we go.
But you can't see it here, right?
Oh, no, but that's fine. Everybody's fine with me doing it this way? They're fine with me?
She just wants you to speak to the mic.
Yeah, I'll be doing that more. Yeah.
No, that,
Okay.
there you go.
There we go. All right. Here we go. Is that much better? Yes. Thank you so much. All right, housing. The Zoning Alignment Project. RASE recommendation pertaining to ZAP. The categories embed accountability measures in all policies to ensure equity and fairness across all services, programs, and delivery models. B2 is to identify and develop strategies to correct all of the impediments that have historically kept Black and other people of color from fully participating in the local housing market, including redlining, exclusion from incentives that increase home ownership, and land use policies that prescribe housing types that keep BIPOC out of the markets. Category is land use regulations and economic development incentives. Work to reduce or eliminate exclusionary zoning. Encourage or incentivize affordable housing in all communities within Monroe County. Another category is impacting social determinants of health to increase racial equity. Amend zoning codes, incentivize zoning and planned development districts to support development of grocery stores, pharmacies, community health centers, primary and specialist care, recreational green space, and fitness centers in neighborhoods with high racial health disparities. Human social services. RASE systemic solution number 1, create and invest in sustainable economic opportunities in Black and Latinx communities to promote and maintain self-sufficiency, entrepreneurship, and career. The guaranteed income pilot provides monthly payments of $500 to 351 individuals for 12 months for a total of $6,000. The program is being funded with $2.2 million of the city's ARPA funds from the city's 2021-22 fiscal year budget. In addition, one private donor committed $6,000 through the Rochester Area Community Foundation to fund one participant for a full year. Eligibility requirements: only one individual per household is eligible to participate. Household income must be or at below 185% of the federal poverty level. Recipients must be of legal adult age, 18 years old or emancipated. Recipients must be City of Rochester residents with city residency for at least 1 year. Recipients must reside in qualifying census tracts or QCT. The city received a total of 16,123 applications. Of those applications, 397 were duplicates and 4,028 were from applicants outside a QCT or who stated a household income too high to qualify. In all, the city received 11,698 applications from qualifying census tracts. And here we have a breakdown, just a few demographics here, some data, where we see female applicants made up 74%, male 24.5, black 73.2, white 11.9, Latino 18.6, other races 14.9, and then we see 53.2 for those that were looking for assistance financially with how to manage their funds. But also we wanted to look at here also the zip codes. 14621, 25.6%. 14605, 13.4%. 14611, 12.8%, and it goes down, as you can see, on how widespread the program reached and how many people came from different zip codes with the amount of applications that the team received. Older adults, recommendation: improving quality and increasing throughout on Meals on Wheels. The Senior Meals Program provided free meals to eligible residents aged 55 up through collaboration with local restaurants and the goodwill of Finger Lakes Region and 211. Participating restaurants receive grants of up to $50,000 to offset the operational expenses associated with the program. Policing, career pathways to public safety. Key issue 1, hiring. We are recommending the City of Rochester enhance the career pathways to public safety program offered by the Rochester City School District. Career Pathways to Public Safety is a partnership between the Rochester City School District and the City of Rochester designed to increase career awareness, and employment opportunities in the uniform positions in public safety. The 3-year program provides youth residing in the city of Rochester with the knowledge, skills, and abilities needed to meet the high demand for diverse and local candidates in the following public safety fields: law enforcement, firefighting technology, emergency communication, 911, emergency medical services, and CPPS will launch in September 2024. And that is the city's presentation of what we have fulfilled and the recommendations for the RASE report. Next, I'll turn it over to David Scott, the Chief Diversity Officer for the county.
Good evening, everyone. First, I'd like to thank Dan for his partnership. First of all, he's a great dynamic leader and someone that I've leaned on as well, and we've leaned on each other in this work as it's not easy. So I look forward to more partnering with him and other members of the City of Rochester, as we are truly partners, whether we want to be or not, but I really want to be. But he is outstanding. I look forward to what we're going to do together in the future. I also want to take the time to acknowledge Andre Evans, the Honorable Andre Evans, who is the Town of Rondequoit Supervisor. He's in the building, so I wanted to make sure we said hello to him. And you know, one of the things that you will hear in our report is that there is a lot of collaboration with the city, which I'm happy to say, because I know in many governments that's rare. So Rochester, in that step alone, is in a much better place than many other governments around the country. So I really appreciate that partnership. So, to get started, we're also going to start with business development. The RACE recommendation was to increase access to county financial assistance and also work with MWB businesses and entrepreneurs to increase their credit readiness. What Monroe County has done is launched a micro advantage loan program of $5.8 million with a minimum of $800,000 earmarked for MWBs. Remember, that's a minimum. This microloan program provides loans from $10,000 to $50,000 to help small businesses with most business-related costs. The Microadvantage Loan Program provides funds to businesses that may not otherwise be a candidate for traditional bank loans. This loan program gives them the opportunity to secure funding while learning the loan process and building credit in the process. Most small businesses are eligible with special features for MWBs, reduced fees and lower interest rates for MWBs, and service-disabled veteran-owned businesses. Almost $400,000 in awards were given to MWBs since August. The next RACE recommendation was to create a local MWB certification program that supports businesses both before and after the certification process. This was launched the prior year, but this is where we stand to date. There are 485 MWB firms certified by Monroe County, with actually 25 applications in the queue being reviewed for certification. We have MBE and MWB total firms is 314. So there's some that are M's, and then there's some that are M's and W's together. 43 are classified as Hispanic. 267 are classified as Black or African American. Monroe County has increased contracting with MWB substantially since the program has started. To host an annual joint city and county MWB business development fair. This is one of the areas that we are proudly collaborating with the city on. Monroe County's Diversity, Equity, Inclusion Department collaborated with the City of Rochester to host this event in March of 2023. The second annual event will be hosted in May 2024, which Dan had mentioned. And the city and county also collaborated with the University of Rochester to host a business development fair in January of 2024 with 300 MWBs participating. The next race recommendation is Monroe County should enact and ban the box policy equivalent to the City of Rochester's policy. Well, that is now law for Monroe County, and Monroe County's law went into effect in the fall of 2023, and applications were updated immediately for all job postings. The next recommendation is Monroe County should consider a living wage policy equivalent to the city's. The City of Rochester's living wage ordinance for July 1st of 2023 through June 30th, 2024 indicates $14.85 as a living wage for individuals who are offered health insurance. Monroe County has a minimum wage of $15 an hour and requires this rate for any organization that contracts with the county. The other one is to permanently fund the Monroe County Diversity Office for language access to promote best practices and address any legal compliance issues. This should not be limited to spoken languages, but should also include ASL and other sign-based communication. And I know that we did make an announcement online. We did have an interpreter here tonight who did have to leave because he was ill. So what we are going to do with this presentation is have it interpreted after it's posted online. So just so you're aware. County housing, this is something that's fairly new, some of it. The race recommendation is to encourage, incentivize affordable housing in all communities within Monroe County and explore additional funding mechanisms for affordable housing development. Monroe County launches $7.8 million plan to increase affordable housing. Housing Search Navigator and Aftercare program. The Housing Search Navigators and Aftercare case managers will connect up to 720 low and moderate income clients or voucher holders to quality and affordable housing. This program includes helping clients with housing options and listings, providing transportations to viewings, assisting with rental applications and providing application fees. Aftercare case managers will provide support for landlords and tenants if an issue arises during the tenancy. The Landlord Incentive Program. This program will encourage landlords and property owners to provide up to 1,500 additional housing units to low-income tenants and voucher holders by offering cash incentives such as leasing bonuses, limited warranties against unpaid rent, or damages and referral payments. The next recommendation is to encourage explore additional funding mechanisms for affordable housing development. The rental repair program. This program will offer financial support for landlords to help up to 600 apartments, making them ready to rent. Participating landlords must own no more than 10 units and enter an agreement that limits rent increases. The Landlord-Tenant Mediation Program. This program provides funding to train additional certified mediators with the goal of preventing evictions by reconciling conflicts between tenants and landlords at the earliest stage possible to preserve housing stability. The program will serve up to 250 landlords and tenants. Monroe County will host a housing developer roundtable to include the New York State Office of Temporary and Disability Assistance, New York State Office of Mental Health, and New York State Homes and Community Renewal. This presentation will describe the capital and operational funding for development of affordable housing projects to a targeted audience of local developers. Under healthcare, the recommendation was to fund training and recruitment of Black, Indigenous, and people of color as doulas and make doulas available as a public health service. $2,200,000 in ARPA funds allocated to the Healthy Baby Network for making meaningful community change program. The program will provide non-medical doula care for vulnerable pregnant women and expand their fatherhood program with a focus on reentry after jail time. Doula services will be targeted toward vulnerable Black and brown pregnant women who are at a risk for adverse medical and birth outcomes. Anticipated to service 670 parents and families through 2026. We adopt an active transportation plan and complete streets plan that prioritize safe streets, walkability, and bikeability in neighborhoods with health disparities that disproportionately affect Black, Indigenous, and people of color. It's the next recommendation. And Monroe County and the Genesee Transportation Council have partnered in an effort to develop a countywide active transportation plan for Monroe County. The CATP will provide the county with an equity-focused, data-driven framework for achieving desired changes to the county's non-motorized transportation network. This may include recommendations for new or revised policies, tools for decision makers, and or transportation infrastructure investments. This report is available at www.monroecounty.gov/planning-CATP. Allocate funding for training and employment of Black, Indigenous, and people of color as healthcare workers at all levels of Department of Public Health. Empower is a program that offers workforce certificates, academic certificates, and associate's degrees in the following areas: healthcare, skilled trades, information technology, and advanced manufacturing. The Empower partnership between MCC and Monroe County directly responds to the need to grow the local workforce. Empower focuses on the upskilling and reskilling of county residents through accessible training based on local market demand. Empower reflects a COVID-impacted economy and focuses on providing solutions to displaced workers or career changers by helping train and transition workers into high-demand, self-sustaining jobs with local employers. Develop a process for staff grievances and or complaints with regard to cultural competence in county departments. Monroe County DEI Department has developed a formal process that complaints can be made regarding cultural competence and other matters. We do have a dedicated EEO manager who investigates the complaints and provides recommendations and training when needed. Create a Cultural Competence Advisory Committee. Monroe County's DEI Department started a Community Diversity Advisory Council in October of 2023 to assist with cultural competency. This group includes populations that serve racial and ethnic groups, faith-based groups, and people with disabilities. DEI CDAC will collaborate with the Department of Human Services Community Advisory Group to create a subcommittee specifically focused on cultural competency that will be utilized to assist the county, with any recommendations that are necessary for people to feel that they could bring their whole selves to the workplace. The RACE recommendation to hire cultural brokers. From the RACE report, these are members of the community who advocate for families and help navigate through the complex child welfare systems. We received funding from New York State that will be used to hire a parent advocate. This position will rely on someone with lived experience to serve as a parent peer partner, helping families navigate the system. Assure that current county and city initiatives regarding mental health emergency response services are fully integrated. This is another partnership that we have with the city. The City of Rochester has the Person in Crisis team, and the county has the Forensic Intervention team. And communications have increased and increased collaboration has occurred. The FIT program is a 24/7 program. In 2023, the program served 2,389 individuals through 3,440 crisis encounters. Recently, both teams worked together to embed counselors and restorative justice supports into 4 City of Rochester resource centers. Develop, maintain, and update regularly a community-wide inventory of mental health and substance treatment resources with online and tablet-based tools that can be used readily by individuals, families, navigators, and clergy for defining needs and facilitating access to care. The Office of Mental Health offers a crisis services guide on their website, which is at monroecounty.gov/MH. This document provides access to phone support, mobile crisis, community-based crisis programs, drug and alcohol recovery supports, and emergency room support. The next recommendation is in regards to older adults. To address the digital divide for older adults, Monroe County funded a community access plan and funding strategy for broadband. A request for expression of interest from community organizations that focus on community education programs was posted in January of 2024. We are seeking an organization that can work with 16 identified groups, including senior adults. This program is designed to expand access to Wi-Fi services to all Monroe County residents and train them on how to navigate through the basics of information technology. Support for education and youth mental health. These are some general DEIJ updates that are adjacent to some of the recommendations, and even though they may not hit a direct recommendation wholly, very, very important to the work that we're doing. The Consortium of Trauma, Illness, and Grief in Schools is a countywide multi-agency effort to prepare school districts to have appropriate mental health support in place during incidents of trauma, violence, illness, and death that impact the school. TIG provides education, training, opportunities, and support to assist schools to effectively respond to the needs of children, parents, teachers, and other school personnel in times of crisis. The TIG website has more detailed information as well as resources on grief, loss, and trauma. TIG collaborates with clinic and outpatient providers to have social workers and therapists in schools on a regular basis due to the demand for their services. And 17 school-based programs in 2023 were developed, up from 9 in 2022 within the city schools. Another thing that we've noticed is support for BIPOC veterans is needed. And what we started was an initiative between the Monroe County Diversity, Equity, Inclusion Department and the Veterans Services Agency. We started a collaboration with WDKX and New Creations Unisex Barbershop. We hosted 2 events to educate Black disabled veterans on benefits that they may not be aware of. Through these events, we have met with 62 veterans that may be eligible for additional financial benefits. And what we found is we know the number of people who identify as veterans and disabled veterans within the county and who's getting benefits and who isn't. And we're trying to make it so people don't have to ask for these benefits. So we're hosting town halls in areas where people meet in the community. So we are also going to be working with the Hispanic community in 2024. Enlisted the assistance of Mercedes Vasquez Simmons, the legislator, and we are going to be hosting these similar events there where we will have Spanish interpretation, because we know that even if you're bilingual, nothing takes the place of your native tongue. So making sure that we have those services available where people have a complete understanding of what's available to them. We've seen some people go from having $1,200 benefits a month up to $4,000 a month, based on the fact that their disability percentage had changed based on how the government views health, and we've been that go-between with the VA, to assist them in getting those benefits. So a program that we're very proud of, and you'll see more initiatives coming up in regards to that. So that is our presentation from the county, and at this point in time, are we taking questions and answers for the city and county? Okay. So Dan, you might want to come up and join me. Are there any questions at this time? Well, just so you know, this isn't a speak now or forever hold your peace moment. You can always reach out to us, or if you wanted to field questions through Dr. Lucas or Dr. Hawkins, they will get them to us, and we're more than happy to answer your questions. And if we can't, we will get back to you once we have an answer. Okay, so thank you for your time and attention this evening, and I look forward to seeing you all again in the future, as we know that we're going to have more successes to bring to you. So thank you for your help and your assistance with us.
Okay, so I just want to thank Dan and David again. It was great to hear about all of the wonderful work that's happening at the city and the county. I know time prevents us from hearing about everything. There's so much more that's going on behind the scenes, but we are grateful for you being able to spotlight some of those huge initiatives that are going on. So at this time, I want to transition to our CART members. I just want to do one more call. Any questions at all for the city and county before we move on? Okay, was that great work? Y'all so quiet. I know it's late, you're tired. You eating that good food from Northern NOLA. If y'all need to get up and stretch and get some more energy, go ahead, it's okay. All right, so we're going to transition to the work of our CARTs, our community partners who have been doing all of the work to implement some of these recommendations, these remaining recommendations that do not fall under the city or the county's purview. In its work, the commission went beyond its scope of looking at merely local laws and policies, as I mentioned, and they started looking at issues under the authority of private companies, nonprofit agencies, as well as local municipalities, including the suburban towns, the villages, and school districts. As you've heard many times, this is about Rochester and Monroe County, not just the city of Rochester. So the work needs to expand throughout. The commissioners saw the importance of engaging all leaders in this process if we are to transform our systems to go from injustice and equity to a system that guarantees diversity, inclusion, equity, and justice for all residents. As we moved into the implementation phase, various community members stepped up to facilitate one of the 8 community advancing recommendation teams. The CARTs are community-led committees established by and existing under the umbrella of the Urban League of Rochester. And they work specifically on implementing the recommendations that do not fall under another entity. They've spent the last year reviewing and analyzing each of the 215 recommendations to understand what was already being worked on by the city and the county administration, as well as what was happening throughout our community by other organizations. They prioritized the recommendations by determining the feasibility of each recommendation to implement. They created strategic partnerships and collaborations, and they identified the key recommendations they believed they could move forward. So we're extremely grateful to the CART facilitators for their engagement and dedication to this work. These individuals are volunteering, as you heard. They're volunteering their time. They are not being monetarily compensated in any way. And they're doing this because they want to transform the community that they love. They're also doing this while managing full-time jobs, caring for families, and handling other responsibilities. However, I always want to say they are over capacity in good intention, patience, humility, and perseverance. And those are the qualifications needed to be a CART facilitator. And we have room for more. Right? So I also want to say that they have held steadfast to making sure that we are working on the recommendations of the commission. As we all know, our community has seen and continues to see its share of unjust acts, and it's easy to be sidetracked by emerging issues as they pop up. However, the CART facilitators are committed to working on the recommendations with fidelity and on the structures that create the inequity. So oftentimes they're asked to make comment on a new issue or add a recommendation to the list, and they've held fast in saying, no, we're going to work on what is in the RASE report. There are 200 recommendations in there. We're not going to ignore those. Not that it doesn't mean that new issues aren't important, but if we stay the course on working on the structures as they are, then that should also address some of these new issues that are coming up. So with that, I want to turn it over to our CART members who will outline just a snippet, again, of the work that they're doing. They're each going to do about 2 to 3 minutes of their presentation, but it's really important for you to see how the community can step in and step up and help to move this forward. And again, I forgot to move the slides, I'm sorry. But with that, I'd like to call up our first team, Ted Polano and Kim Mitchell from the Business Development and Job Creation CART.
Good evening, everyone. Thank you for joining us, and thank you to those of us who are joining us online. I'm Kimberly Mitchell, co-facilitator for the Business Development and Job Creation, along with Ted Polano. We have team members Mazi Bakari, Galen Brooks, Ann Beyer, Matthew Burrell, Christina Eisenberg, Barb Glassman, Jersha Goins, Constance Jefferson, Dr. D.T. Ogilvie, Annette Ramos, Dr. D.J. Robinson, Donette Scott, Gwen Van Laken, and Deborah Witt as part of our CART team. We meet once a month and go over the recommendations and planning for achieving those recommendations. So I'll turn this over to the next slide to Ted.
So we spent a lot of time figuring out which recommendations we felt we could address that maybe needed some work, and the top 3 that we came up with were talking about matchmaking for the MWBE vendors and subcontractors, especially with municipal prime contractors, major purchasers. We do note the city and county have done great work with this, so it's kind of been on more of the back burner for us. So the 2 that we really focused more intentionally on are internal audits of the support services to see where there are shortcomings that are preventing services from reaching businesses, like where are the glitches that are popping up for that. And similarly, looking at the business development services that the county and city offer, how can we coordinate outreach and communication with the small businesses and see if there's any duplication or where some efficiency could be created in those areas. So last year we spent a lot of time trying to figure out which ones we wanted to deal with. That was a big portion of the year, and as we went through, we really found that we wanted to build some awareness of the existing support services. The county, the city, and even the state have a number of support services for businesses, small businesses, MWBE, but it seems like there's a little bit of a disconnect in how those can be accessed, so we want to really focus intentionally on that. Find some opportunities to look at the existing support services to, again, increase engagement, and that has a lot to do with the communication. And then really what we want to do, especially coming up, is work on the dialogue with MWBEs for ongoing support and actually get street level, as Kim has said a number of times in our meeting, how do we just knock on storefronts and see what's going on and really communicate with some of the businesses and the folks who are trying to create businesses. Some of the challenges, like we said, identifying what services are available. Some of the folks may not have internet capacity or trying to use their phone to access some of these big files and all. And that's a little bit of a challenge, so how do we help folks understand that a little bit better? And then just looking at language. We have a number of folks here that speak a variety of languages, so how do we help them access this information appropriately? So again, as we're doing this, we're trying to really figure out outreach to the business owners. We're just at the beginning of that. The city and county, like you heard the reports already, they're doing really good work addressing a number of the initiatives that are out there. So we're appreciative of their help, and they have folks that come to our meeting on a regular basis. And then, working on this translation to Spanish, that's probably the biggest second language that's out there. So how do we make sure that people can have that capacity to read and see and even hear and understand what's out there for them?
There we go. So let's talk about the progress that we've made through this effort working with the CARTs and over this last year. We've created a survey that we want to send out to existing business owners. We heard that there were some challenges that they were facing. We, as the CART, decided to accept that as a challenge, if you will, and get in and see what they're seeing, do what they're doing, and create that data so that when we send it out to the business owners, we have a perspective that we share a perspective that they have with accessing these resources. And we go through various websites, some city, some county, some private-owned websites that, as a business owner and being a business owner myself, was sort of native to me to take a look at what's out there, what's being offered, and what the challenges are with those resources. And as Ted said, we are looking at translating that into Spanish so that our counterparts can also participate in that survey and part of that data collection. What's next for us is to finalize those results. We want to aggregate all the data that we get from those responses in both teams and make that a formal report to the city, to the county, to the community, so we can understand as a collective what the challenges are as a small business owner that they're facing. We're also going to be elevating the voices of these MWBE business owners by building that relationship. We want this to be a dialogue, not just a one-way conversation with the business owners. And we hope to have increased participation by lots of the small business owners by building that relationship. We really want to make this their accomplishment as much as it is ours. So additional calls to action, we want to work with the city and the county. You heard that they have conferences every year. We want to make those and make sure they incorporate actual matchmakers into those events. They are huge, they are beneficial, they get a lot of feedback from small businesses. We just want to make it just a little more effective and invite them to create matchmakers inside of those events. So that's it for the Business and Job Development CART. If anyone has questions, we're available.
Okay, good evening. I'm Cynthia Harriet, and Dr. Rashid Mohammed. We've worked together on this committee. I'm the former chief of police. Dr. Mohammed is just a criminal justice extraordinaire expert. No, really, I lucked out in getting him as a co-chair. But I do want to share that it is extra, but if you may recall or not, but I had said before when I took on the job as chief that this is not a one and done, that if we're going to have an impact in the ways we need to in the community, we have to stay engaged. And see, I wasn't kidding. So, but, oh, thank you. Yeah. very proud to do that and be here, and very proud to work with Dr. Muhammad. And I must share, as you know, this can be a volatile issue, but for the most part, I've been happy with our committee. It's true, sometimes, people are passionate and they may want to get sidetracked a little bit, but I've learned we got to stay the course if we're going to have an impact, because if you'll notice, as we think about the past and what we're dealing with now, these issues have come up before, and we just need to come up with sustainable solutions on that. So you have our committee members. I'm not going to read them all, but like I said, for the most part, I'm very happy with our committee. Everybody is consistent and works hard to try to come up with some great solutions, so I'm pretty pleased with that. So, all right, that's on me, right? All right. These are the recommendations we chose. And for the most part, we wanted to hit the ground running. We wanted to really get on top of some of the critical issues that we knew were current, and there's a lot of work being done out there, so we wanted to see what ways we could engage in good sustainable outcomes, but also, take into account the work that's being done out there right now. Our first priority is to end the use of pretext stops, and these are stops for minor offenses that are done to investigate other causes. I do want to share that we have met with the group primarily that has done a lot of work with that, and Dr. Muhammad's going to talk a little bit about that. I want to stress that we've also talked to them about reaching out to the gold standard of policing groups like the National Organization of Black Law Enforcement Executives, the International Association of Chiefs of Police, Police Executive Research Forum. A lot of them have that background, and they've also done a lot of work in research, developed model policies. So you've got groups that have been on the front end of trying to impact change in this area. So we really encourage them to try their best to work together on that. Our other priorities is to expand the pre-arrest diversion programs using culturally competent intervention services. As someone who's worked a little bit in that area as well, for example, worked on the school climate committee to redo the code of conduct policy for suspensions, because we saw that suspensions early for children almost guarantees they're going to kind of get segued into the criminal justice process. So very happy to work on that. When you get an opportunity, it's online. I think it's on the Children's Agenda website. Take a look at that. Since that process has been implemented and what some of the outcomes we've seen, they're actually excellent. And then finally, we wanted to address hiring for policing, training, operational practices, and community engagement. We have to work together, and the community has to have some impact into what our law enforcement agencies do, and that has to be a constant dialogue. You can't sit down, have a nice meeting, project, and go on your merry way. You have to be vigilant. It's got to be an ongoing process. So again, we were proud to work on these recommendations. I think you're going to be happy with the outcomes you see as we move forward. And then I want to invite Dr. Muhammad to come up and talk about our next steps.
Thank you, Chief Harriet. For our year in review, we looked at the recommendations. As Dr. Lucas mentioned, the first part of our effort was to take a look at all the complex issues and parse them out. There are things that have complexities to them that were called out in the RASE Commission. An example of that would be a change or a modification of the consent decree that the federal court put in place in 1975. And working towards for that last August, actually that consent decree was modified. So that would be an example. Another example would be, how do we certify and train our law enforcement officers? That requires a change at the New York State level. So that would give another example of some of those complexities. The other thing is that Dr. Lucas mentioned is that there's a lot of dynamic issues that come up, of course, in the area of criminal justice and policing. But keeping a laser-sharp focus on the specific recommendations that the wonderful commissioners put in front of us as one of the things that our CART doc talked about and maintained our focus there. One of the big areas was to identify things that already existed and collaborate. You see some of them listed there at Empire Justice Center in terms of pretext stops, the 7th Judicial Districts with Judges Bailey Turner, Judge Doran, Judge Van White, Judge Reed, and the Rochester Police Department, the District Attorney's Office, I'll talk a little bit about that, and UCLM, the United Christian Leadership Ministry. One of the collaboratives that's not listed there, but I would like to take the podium and call it out, the Rochester Monroe County Anti-Poverty Initiative. Aqua Porter, let's have a hand. Let's have a hand. The exemplary work that Ms. Porter and her team are doing are very important, and we are establishing collaboration with them as well. For our progress report, the chief mentioned that we have 3 different areas. In pretext stops, that is a nationwide problem. We've taken a look at academic data, data from different police departments and municipalities, and we see some inequities in what we call a pretext stop, and that's where an officer may be stopping somebody for a reason other than what is explicitly stated. United States Supreme Court has said under the 4th Amendment that that is allowable, as the New York State Court of Appeals has also said that. However, we see the inequities that are resident there, and we work very closely with Empire Justice Center's police reform project that is going in depth and looking at the pretext stops. That project is being done in conjunction with the Rochester Police Department, specifically Deputy Chief Stiff, and Jill Paperno and Katie Blum from Empire Justice Center are the principal attorneys that are leading that project. Working cooperatively with them, that is satisfying or looking directly at one of the recommendations in the RASE report. So we have a pre-existing activity that does that. Similarly, for diversions, the Monroe County Criminal Case Diversion Implementation Project, I managed to say that without getting myself tongue-tied, led by Judge Bailey Turner under the 7th Judicial District's Justice for All effort, is looking at diversions. Under that program, Judge Bailey Turner had us take a look at all diversion programs happening in the community, also within the justice system, and evaluating those, and then taking a look at things that the RASE report has called forward in terms of diversions. We're also working with the district attorney. There's an effort coming out that you'll hear more about called the Data Commons. The Monroe County District Attorney has agreed to a diversion goal of raising diversions in the criminal justice system from 1% up to 10% within a year's time. So we'll be looking at that. But that, again, satisfies directly some of the things that are called out in the RASE report and gives an indication of the collaboration that we're trying to achieve with different initiatives. For the last one, I'd like to turn it back over to Chief Harriet.
Thank you, Doctor. And I'll be brief. Again, this focuses on hiring, operational practices. I cannot stress enough that standards are critical. If you recall, in my 90-day plan for the police department, one of the things I talked about was standards for promotions and hiring. And you had to meet a certain standard. If you had discipline issues, that these were things that would exclude you from being promoted while I was chief. Because the other thing you want to do is you want to reiterate to your staff that you get rewarded, you know, when you do things the right way. And and I'll leave you with this also. I just want to stress that every profession has their issues. You know, you have personnel issues, and we have to uplift the ones that do the job well and do it the right way. We have to uplift them, and then the ones that don't, then you address it, and it's not complicated. But at the end of the day, standards, putting the effort into our high-quality training for our folks and giving them a good foundation on how they're going to do their job for the rest of their careers is just not something I cannot focus enough emphasis on enough. I do want to take a little minute to thank Dr. Rose back there. She, for the city's HR, had to call on her quite a bit here and there for different things. A lot of times, you know, a lot goes on behind the scenes. People don't always get the thanks. Not that she's looking for it, but I just wanted to know I certainly appreciate it, always being available, willing to listen. Again, thank you. And our personal thanks to Dr. Lucas. You know, I know your work. I know you're getting a lot done out there. And then also Dr. Hawkins. Just your energy, your passion for this work is unending, and we're certainly very pleased to work with you on this journey. Thank you very much.
All right, my name is Joseph Fargnoli. I had the pleasure of facilitating the education cart. I think it's important really to frame the way this group looks at the challenge that we face. Here's a quote that reads, "The primary, the most urgent requirements is the promotion of education. It is inconceivable that any nation should achieve prosperity and success unless this fundamental concern is carried forward." So there's a gravity to this group. And we've got a great group of team members here. Christine, Fred, Luis, Dan, Joe, Darren, Tricia, Stephen, Nicole, and others. I also want to call out Taurine Uthman and Audrey, what's your last name again? Clemens. Two really wonderful, I call them my co-facilitators, but they wouldn't let me put that up here. Really great. If you want to know what youth leadership looks like or developing leadership looks like, look at people like this. The Urban League is developing great leaders like that, and I've really enjoyed working with them. The whole team has been fantastic, and I really love the spirit of service by which we bring to this CART activity. I'm going to describe to you how we came up with these, how we chose these 3 out of our 19 recommendations. But again, another quote I think is really important, because when we think about the RASE Commission, we think about the summer of 2020 and the energy that was created that summer. And it was a really unique time. And this quote reads, "The American people will grasp the possibilities of this moment to create a consequential reform of the social order that will free it from the pernicious effects of racial prejudice and will hasten the attainment of a just, diverse, and united society that can increasingly manifest the oneness of the human family." So we do not want to lose that energy that was created that summer. We are committed to carrying it forward. We are very appreciative of the Urban League providing the structure under which we could work. And we looked at our 19 recommendations. We wanted to get them all done all at once. Wasn't realistic. So we underwent a process to select the top 3. I'll describe that process. It was not perfect, but we chose to go forward and execute on the first 3 that came out of that. The first one is developing a K-12 anti-racist curriculum training in all Monroe County schools, not just RCSD, all Monroe County schools. Tackling the issue of recruiting, retraining larger numbers of Black and other teachers and administrators of color, and looking at the use of alternative forms of assessment. Now, to choose these 3, it wasn't like the RASE, the education group just chose the 3. We reached out to the community through social media, through a Black Scholars Early Recognition event. Now, it wasn't the most perfect survey, but it was a survey. We looked at getting professional surveys done beyond our budget. We said, let's start here. So with these 3, we said, hey, let's go for base hits, right? Let's use an agile project approach, kind of developed in the software world, where we prepare, we plan for sprints, and then we sprint. This has worked for us. We've also employed a process that really creates a learning culture in our community as to how we come together as citizens. I like to say we're the butcher, bakers, and the candlestick makers on this cart. We're just a bunch of average people coming together wanting to make a difference. But we use this process of consultation, action, reflection, and study. We consult thoroughly. We listen to all voices. We invite all voices to our table. But we quickly move into action steps. We assign work. You come, it's a good chat, but you're going to get assigned work. We assign work, and then we reflect on that work, and we look at where do we have to study? Where do we need to know more? Where does the candlestick maker need to know more about certain things? And we go out and we learn those things. This has been a great process of the community coming together. We determined that we wanted to make sure that we can implement these recommendations in a way that are practical and really realizable. So plans are being and can be made implemented with collective action. This is the ethos of the way our CART operates and the way most CARTs operate. We're focused on building unity of purpose and fostering participation of what we call men and women of goodwill seeking to serve the common good. We acknowledge our community is rich in resources, some formal, some informal, very rich in resources, seeking to work to implement these recommendations. We have found a lot of goodwill in our community, a lot of energy, a lot of resources to help when we ask. And again, I thank the Urban League for creating this structure that we can work under. Now, what have we done? Not as much as we'd like. We need more support. We meet every other Wednesday. You are all welcome to attend, encouraged, pleaded to attend. But for this first recommendation, we went out, this is the anti-racist curriculum, we went out and we surveyed anything we could find that seemed to address this. We looked at multiple sources, recognizing the expertise, and we recognized the expertise and experience of the anti-racist curriculum project. It quickly rose to the surface as a local activity that we thought was amazingly credible and amazingly well-directed to what we wanted to see get done. The anti-racist curriculum project is under the leadership of Shane Weiglin and Keisha James, another two superstars in our community. We said this looks like an answer to addressing this recommendation. So we don't have budget, we don't have authority, but we have consultation, we have thought, and we have voice. We used that voice to put together a recommendation letter for them that was very strongly worded, supporting their work. And we'd like to say that we helped to successfully advocate for governmental, corporate, and foundation funding to increase their staffing for more professional development, observations, feedback, and curriculum development. We did a 3-year plan with them and said, you're at this level. To be effective, you probably need to be more at this level. And we said, community, give them the budget. It worked. Right now, to date, Shane Weiglin, Keisha James, two real superstars. To date, almost every school in the district has participated in their training, with the exception of 2. But we're looking forward to working with also Churchville and Brockport in the near future. 2,400 teachers participated in training between August 23 and March 24. Maybe that's a double. It's not a base hit. We're happy with that. More to do, though. So, again, we didn't quite totally solve it, but that's what we did on recommendation number 1. Recommendation number 2, we formed a really quick partnership with the RCSD Human Capital Office initiatives. This is Dr. Chris Miller, Amaret Miller, and Dr. Case. And that partnership was to increase the number of teachers of color, recognizing the need to continue funding. Now, they are on some kind of COVID dollars, ARPA dollars, I'm not sure what it is, but they're on temporary funding. We want to advocate that their office should remain intact. We need a very aggressive campaign to attract teachers of color and administrators of color to the RCSD. We also looked at the other end of the process, the last in, first out process. This involves taking on the teachers union to say the way, when there are downsizing, unfortunately sometimes there have to be, we need to consider different criteria for downsizing, not just most recent hire gets walked out. There need to be considerations so that we're achieving that balance that we want in teachers and administrators. Somewhat of a chaotic vision to say we're going to take on the union, but we think that's what has to happen here. Another initiative is we believe a majority of the RCSD and county teachers are white, not that we believe it, it's the fact, but they need professional development and cultural sensitivity, anti-racism, pedagogical, and developing positive teacher-student relationships. So with all who are there, these skills need to be implemented. A PD program needs to be developed to facilitate this so that they can better meet the psychological, social, and academic needs. Now, there's some research behind this that some teachers and administrators have been subjected to, but we formed a really excellent partnership with the RCSD Human Capital Office. In fact, shortly, today, tomorrow, there's going to be a press release that comes out called Together Rochester. We had a hand in helping to shape that. The idea of the community coming together and taking ownership and responsibility for the education of our children. It's not just parents and teachers, it's a community activity. It's a great campaign, look out for it. I would encourage you all to participate in it. Okay, looking ahead. Again, the space that we've operated has been a great space, but we recognize there's a diversity of voices in our community. There are pockets, there are different presentation styles, there are different cultural adaptations. we are encouraging creating additional spaces beyond the carts to hear all voices in our community in diverse and grassroots settings, particularly in settings that are more accommodating to those who are particularly affected by these issues. We are working to continuously recruit individuals on a continuous basis, and we need support and aid in tackling these issues. We ask that as a community, we're not pointing at our CSD, we're not pointing at schools, we're saying as a community, let's challenge our views of what is true education. I've got to admit, I do work in artificial intelligence, and it scares me what's coming. What does it mean to educate a human being? Okay? Let's challenge, we're Rochester. We're the ones who do things first. Let's challenge ourselves to look at our views of what is true education, recognizing that the full human educational needs need to cover intellectual, mental, emotional, physical, and spiritual. Let's tap the wealth of this community because it's here. We got it. Let's tap it. Let's seek inputs and solutions from faith-based initiatives, rethinking how we tap community resources, re-challenging our definitions and our boundaries. Let's integrate the learned experiences from charter schools into the conversation. What resources are they getting? What results are they getting? What can we learn? Great. I think there's 8,500 kids in this city going through charter schools. What can we learn? And lastly, I'm asking everyone in this room to believe with conviction that we can and will be able to make the required changes to improve educational opportunities for all as a basic human right. Thank you.
Good evening, everyone. My name is Dr. Thomas Green. I've never said that out loud publicly, so that's my first opportunity, I guess. Thank you all. I am so pleased to be a part of the healthcare cart along and give leadership along with Jackie Dozier and our other team members whose names I won't go through. But it has been a privilege to be able to give leadership during this last year. I wanted to say, as I start, thank you to the city and to the county, to the Urban League, to everyone who has continued to move the goalposts, to keep things going, to make sure that we're accomplishing things. And so I really do appreciate that. I've been studying health disparities for 3 years now. So to see that there are so many things going into helping to move health equity is just really important to me at this particular point in time. So I want to apologize because on this slide there is one key issue that's missing in healthcare, issue number 6, which is anti-race training and leadership. Which you've seen some of the work under racism as a public health crisis. And I apologize that I lopped it off when I sent my presentation. But we've been working on looking at these 6 key issues, and we've broken down the issues with leaders, so because there's so much there. And one thing we recognize that when we look at healthcare, when we look at all of the 8 areas that we've looked at under the Commission's work, is that everything is a puzzle. And we're trying to bring the puzzle together. It takes all of us. And so when we bring that puzzle together and we want to work on different parts, it's going to take us making sure that we put the energy that is needed towards each of the areas of what the work of the commissioners has done. And so what are our recommendations, our summary of our recommendations? I'm going to sum this up in saying establishing a standing health committee. We have been working over the last couple of months and understanding what that means to have a standing committee in the county legislature, or what does it mean to have a standing committee in city council. And so that work of understanding that and moving that forward is what we have been doing a lot of in our committee and meeting with those who understand how to make that happen. We recently had a meeting with some members of the county legislature to help us to understand that. We recognize that Climate Advisory Committee and the Committee on Housing have come before us, and so how do we make that happen? So there is. So when you look at the back of your bookmark, you'll find that one of the things on here is in the middle it says the charge of the commission was to review local city and county laws, policies, and ordinances. So policies are very important for us, and that's what we're taking the opportunity to try to give some leadership to that. So we do want to increase our participation from community leaders, and thanks to Dr. Lucas, we've gotten a lot of leaders in the healthcare arena to come and be a part of our committee and to help us. We do want to continue our efforts and make sure that when we report back the next time that we can say that we have gotten a committee. Now, I want to just take a moment to pause when I talk about, because the report said a standing committee. And so in our research, we recognize that there might be other ways that might be best. So we have to figure out how do we best align within the city council or county legislature to make sure that the work that the commission had envisioned is being done. And so we're working on that to make sure that that happens. And so again, we want to make sure we continue to analyze the work that's being done. That as those puzzles, the city's doing things, the county is doing things, and we're bringing that puzzle together. And we want to make sure that if there's some gaps in there, particularly when it comes to healthcare, that our committee is there to identify that and to be a bridge within that gap for things that need to be done. So I do want to close with saying this. There are 47 recommendations that are in the healthcare card. We know that the city is doing work. We know that the county is doing work. We know that there's work being done by other entities. And it's important that if you are doing work, when you look at those 47 recommendations, that you reach out to the Urban League, that you reach out to Dr. Lucas, and let us know the work that you're doing. Because as Dr. Hawkins was always saying, we want to make room for you. We want to celebrate you. So if you're doing that, please come to us. Please let us know the work that you are doing. Thank you so much.
Oh, golly. Just think, we're halfway through the carts, over halfway. And ditto to all of our cart colleagues for all the gratitude that's been going around. So, and also want to say on behalf of Ron and I that we are extremely grateful to our team who are keeping us honest on Zoom right now, I hope. We have, and they're in alphabetical order by first name, I should note. We have over 30 active and passionate members representing those living through this area's housing crisis. Several folks on our team were part of the original RASE working group, and they are denoted by the asterisks. Thank you for your faithfulness on this long journey. They, us, are all passionate about those they serve, and we work across the continuum of housing, from the unhoused on our streets to shelters, to transitional housing, to rentals, and to home ownership. We do want to break down the silos across all the good work that is being done locally. Am I still here? No, I'm not.
You can be there if you choose.
No, Ron is such a gentleman.
Thank you. Good evening, everyone. My name is Ron Washington. I am the Housing Director at the Urban League of Rochester. So we spent much of 2023 reviewing the RASE recommendations and determining who was responsible for advancing those recommendations and what community organizations were involved with their advancement. Once gaps were identified, by consensus, we prioritized those recommendations where we could be impactful, either leading the recommendation or collaborating with others who were actively making progress. So we looked in on these three. Our recent focus has been to mostly focus on exclusionary zoning, and we have turned our attention to advocating for expanding community control models like land trusts and opportunities to purchase. And we're looking forward to collaborating with the city and the county on this. Of the key issues cited in the RASE report, these three were adopted. This is my team member here, she got my back. Of the 4 key issues cited in the RASE report, these 3 were adopted by the CART. I think we're having an issue here, but you can hear me well, right? 1, despite laws against discrimination,
We are going forward, no? Yes. Key issues.
right.
Yeah, you're reading here. Yeah.
Yeah, okay. So despite laws against discrimination, such practices still exist, like not renting to non-English speakers. Where there are laws, we can advocate and increase funding for those who encounter these practices. So the key issues are discriminatory practices in housing, especially practices that discriminate against tenants, land use regulations and economic development incentives, where exclusionary zoning limits affordable and multifamily housing. Housing affordability, rent-burdened residents limit financing for low-income housing, and the affordability of 65 to 70% of Rochester's rental properties are owned by those who do not even live in the city. And we know that renters are rent-burdened, paying up to 50% or more of their income for rent. So we really have too much of a crisis. Anywhere from 50 to 70% is considered a crisis. So we've identified some of the challenges. Zoning does not build housing. City invited recommendations, less complex for developers and builders, less restrictive for multifamily dwellings. Many new affordable developments happening, but limited financing for less than 50 AMI. Low income, low credit, transportation hindrances combined with high rental prices and low inventory. 4 new county tools announced, right?
By David Scott.
By David Scott.
Yeah, just a little while ago.
Congratulations, David. As clocks ticks, identified funding sources may disappear and/or supplies, contractor costs will have increased. And the appetites for inclusionary zoning, like ADUs and recovery, transitional, and permanent support housing, states pro-housing initiatives. Land trusts can encounter unsustainable portfolio maintenance costs, and renovation costs can be exorbitant, and new bills are needed for subsidies. To overcome these, we're going to include ourselves in more town halls, breaking down silos, and meeting with ZAP and speaking to City Council. I'll turn it back over to.
So I can highlight just a couple of things. We have, in the area of zoning, recognizing that, and thank you, Matt Simonis, for always saying to me that zoning does not build housing. We do need increased zoning for doubles and triples and low-rise multifamily housing in residential neighborhoods. And also, it's just fantastic, over 1,500 new housing units are going up across downtown Rochester. Some are already up and sold, and that's not to mention the hundreds that are planned for Bull's Head. That's huge. But the question remains, where is the financing and development for those under 50% average median income? And to the pro-housing, we applaud that 8 towns have just applied to the state's application process, and we all must encourage towns to take advantage of this new funding. We also hope with the new tools that the county has announced tonight through David Scott that this CART can be invited to the Housing Roundtable. I'm closing it out. The progress, we did engage, by the way, with the ZAP process. We have held some zoning 101s with the local developers and ZAP, and we sent our recommendations forward thanks to our team members. We have started research also in the other zoning area for the towns, and we plan to understand through direct meetings how we can help positively impact their visions. Land trusts, we now have scheduled, and you're invited, March 27th, our regular meeting. We will have a Land Trust 101 from our own Graham Hughes of City Trust, or City Roots Land Trust, forgive me. As to tenant protections, many of us have not only participated in Albany, but right here in Rochester in some of the activities to fund a vacancy study by the city and also move forward with tenant rights. We've met with our MAPI, and also thanks to Brian Lewis here, he's here somewhere, was here, Rock the Future Alliance for points of collaboration, and continue to look forward to doing that. And I'm going to close this out saying, where are we going in 2024? Looking ahead, we're going to hold ZAP accountable. So we're going to follow through with that process. We are planning to meet with the towns. We are developing a strategic plan. Any planners, come join us for how to take advantage of community-controlled opportunities. And we want to keep recognizing and be involved with any intersections, especially with education, health, and job issues. In terms of obstacles, there's always who is missing from this conversation, and you have an opportunity tonight to please let us know if you are missing or who you think is missing. We want to create a countywide movement. Let's go. And I would ask, just ask, in the vein of Matthew Desmond, when was the last time you attended a zoning meeting? Thank you for your attention.
Good evening. My name is Pat Willis, and I'm a community member of the Human and Social Services CART. I'm not Rabbi Dr. Sandra Katz, but I'm here representing her because she's out of town. The team members are listed. You can see we've got a team that has benefited greatly from members of the city and the county services departments, and have given us a lot of insight, support, and understanding. Significantly, the services that are provided for human and social services recipients are impacted enormously by the state regulations, and so this is something we've had to understand during our meetings throughout the year. Okay. Our recommendations are to develop a county and city cultural competence plan with designated budget resources, the county does have an advisory committee, and so we are working to collaborate with them and to explore how that can come about. Our group has also included community providers, and that's been a big resource to us. We've also benefited enormously from Dr. Lucas and Audrey Clements in providing support and resources and guidance to our CART. Our summary includes cultural humility, which I think is a very apt term to understand the needs of people who receive services and our role in making sure that those services are appropriate and accessible. As I said, we're collaborating with the city and the county in the advisory committees and councils that are in existence or being developed. And that work is going forward. As I said, some of the challenges have to do with the fact that state regulations are significantly a part of the delivery of services to our community. If there are any questions, I'll be glad to take them, pass them on.
Good evening, good evening. Glad to see you guys are still here with us. I'm going to go real quick here. So my name is Regina Bradley, and I'm the CART leader for the mental health and addiction. Going a little too fast. They say the sweetest sound to a person is their name. So I'm not going to call off all the names, but I do want to just call off the first names. We have C.S. Anderson, we got Mike, Roberta, Julio, Mario, Carlos, Fred, Florence, Aaliyah, Sabrina, Yasmin, and Van. So that is my team. Our top 3 recommendations that we pulled right from the RASE report. I can talk faster if I read from here. Develop, maintain, update regularly a community-wide inventory of mental health and substance treatment resources with online and tablet-based tools that can be used rapidly by individuals, families, navigators, clergies. The county also talked about this first one. The second one is re-examine and modify the interpretation of DHS regulations that affect people with mental health and substance use disorder, including but not limited to attendance and compliance requirements. The third one, develop community behavioral health advocates, CBHA. This is a program employing local residents who are trained and certified to assist people with advocacy, offer help to connect with and navigate behavioral health services, identify distressed persons who need services before emergencies occur. Just want to say that again. Identify distressed persons who need services before emergencies occur and provide low complexity therapeutic interventions as appropriate. Summary of recommendation, there's a lot on the screen. I'll try to get through it real quick. Our key issues that were raised up from the report actually was mental health and addiction services are often unaligned and disconnected, as our city and county initiatives on these issues exacerbating and prolonging racial and ethnic inequalities. County interpretation of state, federal regulations for people undergoing addiction or mental health treatment, including but not limited to program attendance and compliance requirement, may unnecessarily disqualify people from accessing services. Availability of sufficient high-quality mental health and addiction services is extremely limited in trusted community settings for people of color and low income. Identified challenges. Monroe County has a large number of mental health and addiction providers and services, but limited coordination and cooperation among them. There are no local workforce of diverse, trained, community-embedded health and mental health advocates, navigators who can play a critical role in connecting people of color and low-income people to mental health and addiction services. The county and the city talked about that earlier. So what are some of the ways that we overcome some of these challenges that were raised up, and especially in pertaining to the recommendations that we selected? Well, there was an open discussion with the Department of DHS on New York State compliance requirement for people undergoing mental health and addiction treatment. I'll talk to you about that on the next slide. And another challenge here is that we're looking to interrupt the behavior by identifying and engaging non-clinical organizations. So a lot of what we hear about when it comes to mental health is some of the deficits we have around the clinical side of it. But we also need to start thinking about some of the non-clinical initiatives as well. Progress report. Okay, so here's what we've done so far. So the OMH is in the process of launching an app to include Monroe County contracted providers only. Again, remember, the recommendation was that it be all-inclusive. What they're building is an app that's only going to be with those that they're contracting with. Opportunity here, dedicated resources. Who's going to be responsible for updating that? Who's going to make sure that it's always current? We don't want to send someone to a resource and it's outdated. Another thing that we talked about in the team, per DHS staff, a report will be released shortly providing updated data on sanctions for 2023. Glad to hear that. Contracted agency follow the guidance from New York State. So that's what we learned in our discussion with the Office of Mental Health. It's not so much that these sanctions are coming from Monroe County, but they're taking the lead from the agencies in which they're working with. So the question that we still have on the table to DHS is who challenged the agencies? So when we're sanctioning, do we have the same understanding? Do all the agencies have the same understanding? What are some of the, do we understand why the non-compliant? So if we're sanctioning people, do we all have a good understanding as to why we're doing this? And are the agencies adequately staffed? So maybe that could be part of the problem as well. They're not properly staffed. Do they have the training? Do they have the resources? So we feel we need to dig a little deeper with DHS and ask these questions. Community partners are working collaboratively to identify, this is what we're doing. This is our progress. We're working collaboratively to identify non-clinical organizations or initiatives with programs designed to assist individuals and families in managing mental health and addiction. One of the things is, and I do want to give a shout out to Dr. Tammy Butler over at the House of Mercy. She compiled, I'm taking a class there, and Tuesday I missed the class, but the group got together and they compiled some of the listing of resources. Now these are people with the experience saying, here's some resources. So we got to make sure that these are things that are brought to the forefront when we're working with people with mental health and addiction. You got to go to the people that have the experience, that know what they want. Mental health and addiction advocacy, conducting outreach, building community relationships, and providing non-traditional approaches in managing health and substance abuse. That's what we're looking to do. My team is looking to do, what have we not tried? What's missing? I mentioned Dr. Butler, EE Pathways, the House of Mercy, Recovery Houses of Rochester. They're running a program now for certified recovery peer advocates and mental health training. And I feel so honored to be in the course because it's for those with lived experience. But I talked to Dr. Butler, and she says, no, it's for you as well, anyone that have an interest. So those are the things we need to be considering. How do we get community people involved in taking these training so they know the basics, some of the things, so you'll understand the stages that folks are going through. You recognize certain things. That's how we become better and stronger as a community. We also working with Action for a Better Community and partnershiping with the CART, in which a proposal through Carlos Santos has been submitted with them, and something that he's working on as well. Okay, looking ahead. I'll slow down a little bit because I'm going to stay within my time. Looking ahead, identify and engage non-clinical organizations that provide alternative. Before I read this, let me just kind of frame this a little bit. We realize that RASE report has raised a lot of needs in our community. It also highlights a lot of deficit. But one of the things we have to continue to realize is that Rochester as a community, we have always been a strong community. I think Joseph alluded to that. We have always been a strong community. We have a lot of resources in our community. We have what I like to call the informal economy. And those are people that are they're running these programs. They don't have the fanfare, but they're making great strides in our community. They're making change happen, but they don't always get the, because they're not out there, they're not connected, they're not engaged. So we want to develop, so identify engaged non-clinical organizations. So again, like I said, Dr. Butler has already started helping us with that. I got a 3-page here from the team on some of these resources. Similar to what the county is doing, what Dave said, they're putting together a list. Well, we want to put together a list too. But we want this list to include those that are non-clinical. Remember, we're trying to hit individuals before the crisis starts. We want to get it, we want the preventive approach. What are some of the programs that are out there? You know, are they in the churches, are in the community? Where are these programs? So that's what our team is going after. Second bullet, identify successful non-clinical community initiatives that are doing preventive or proactive work in mental health and addiction. Talked about that. Identify and involve more agency voices missing from the conversation. Again, it goes back to compiling this list, connecting people with resources. Recruit community members who are passionate about advocacy. So one last thing I want to say before I advance the slide to the final card, and that is, in working with mental health, we realized when this RASE report came together, it was behind that energy of Daniel Prue. So we know that mental health is something that's very, very important to our community, and this is why I continue to stay involved, stay engaged. Like Dr. Lucas said, I'm taking 2 classes right now. Not only am I working a full-time job managing this, I also have 2 classes, and then you got the family stuff that we all deal with. But it is important that we make some advancements, some strides. We have to find other ways to fill these gaps. We have a lot of deficit, so we have to find ways to fill it. Thank you for your time. Thank you.
Good evening. My name is Martha Hope. I am with Senior Expressions, and I'm one of the facilitators for the older adult cart. And certainly we are, when I say older adult, we are not least. We are the bomb, as my granddaughter says. I'm not giving up on that one. And I'm going to go as quickly as I can. I was just telling Dr. Lucas, if somebody doesn't show me how to clip this thing to move from one place to another, my granddaughter's not here, so I'm going to read my little script here. That's okay. I can handle this. Okay. Oh, that little thing? Yes. Okay. All right. Top 3 recommendations is to support the Rochester and Monroe County Age-Friendly Livable Community Initiative. And that means to keep us safe. When I say us, I'm talking about older adults, to keep us safe, affordable housing, transportation, and access to affordable health care. So that's very important for us at our ages. And what I do with is, has anybody ever been to the senior ball? Haven't been? Well, we're having it again this year on the 21st of September. You meet old friends. It's about socialization and not being lonely and not being isolated. It helps us come together. So, recommendation number 3, establish an older adult health care task force. And that's important. So what happens is, many times people are telling us what to do and not asking us. So what we're doing in our health card, our older adult card, is to set up focus groups across the community and ask the older adults, what is it you need? What are your needs? What would you like to see done? So that's what we're doing right now. Address the long-term conditions of elder poverty by joining community efforts to raise wages and address employment discriminations. And a summary of recommendations to support, again, the Rochester Monroe County Livable initiative. Establish a older adult health card. I'm having problems with a cold this year, so right now, so just don't worry about my voice. And to make proposals and help to pass laws and work with the legislatures in our community in order to make things happen. And that's hard to do sometimes. To upgrade senior centers and in our neighborhoods. Quite often, our neighborhood centers are not adequate for our seniors. Elevators are broken, toilets are broken. There's no real safe access to the center itself. So there's a lot of work to be done. We're working on that. There's a matching of funds that we're working on right now for adult services to address the digital divide for older adults, to create programs and training for adults. You know, when I click onto my card, it took me a while to get it together. So we need the training and we need the technology because, as I said before, we're worth it. We put our time in, and we need to, we really have. We put our time in. What I do at other presentations, you know, society and ageism has had us thinking that age is some kind of a curse. Well, it is not. It's a part of the journey. How about that? So what I do is I say, today I am Martha Hope, and I am 79 years old. That's right. And if the Lord allows me to be here, I'll be 80 on the 27th of March. And I am not ashamed. So, and addressing the digital divide, we're not familiar, like young people. My granddaughter can just come into the room and say, I say, Kyla, so-and-so and so. Grandma, all you have to do is da-da-da-da-da. I said, oh, okay, okay. So if we have training programs and bring in our older people to just show them how this goes, because what is the world today? The world of technology, everything. I don't even use my checkbook anymore. I stick the card into the, you know, I had to learn to tap it, and that's it, but I stick the card in there. So I know that sounds silly, but it happens, okay. We would like to address the long-term conditions of elder poverty and discrimination. We've already talked about that. You know, all of us don't want to work at Walmart, okay? If we have skills, if we're educated, we want to be able to stay on our jobs longer. We want to be able to go out. Once we retire, maybe we want to do something different or do something else. But you know what organizations are saying and institutions are saying, that you're too old. And they're waiting for you to get 65 years old so you can retire. But we're still good. We have things to offer. Another recommendation is for the state and federal legislation to protect the enhanced services, especially for older adults in poverty. And we can be. When someone tells you that they get $800 a month for Social Security and your RG&E is $1,100, then what? So we have work to do. And address, of course, the issues that laid bare for COVID. We know that COVID left many of us in a tizzy, okay? Progress report and some of our wins. Recommendation, a combined Rochester, Monroe County, age-friendly, livable community plan has developed in 2021 by the Monroe County Aging Alliance. With input from diverse population of local older adults, which is myself, everybody on our card is just about over the age of 60. And you know what happens. And when you become 50 years old, oh, I'm getting old. But we're not. We're not. Let's take another look at that. But everybody on that card is 60 years and older. So we're doing a good job. We've completed a second year of this implementation with 46% of action items partially or fully achieved across the plans of 86 action items. Recommendation 7, digital equity. We've already talked about that. Individuals need training. We definitely need training. Monroe County recently updated its website to include, and these are things that are wins that we have worked on, and it's working. Monroe County recently updated its website to include language and options and exploring additional accessibilities. So we're working on that, and still working on that, but we're doing a good job. 10, Greater Rochester Area Partnership for Elderly's annual legislative advocacy breakfast in February focused on advocacy for programming to support older adults in poverty. Thank God for that. They think we're supposed to go in a nursing home or whatever. I already told my kids they already have the plan. I told you what is going to happen. I'm not going into a nursing home. So somebody pass me around. Find a bed for me. And don't tell me what to do when I get there. Looking ahead, action items, the card is we're working on that now, is a work group. A work group has been formed to collect data on city senior center participants' preference. And that, what we're doing with that, we're forming focus groups across I've mentioned that before, forming focus groups across Rochester. And anybody that wants to join, we've kind of started in our, started in the high rises, and that's across the city and the county, and asking older adults, what is it that you need? What is it that you want? Rochester Works and Lifespan are collaborating on an older adult employment resource fair. So when it comes up, look for it, it's coming, and they're going to work together to get that done. Aging Alliance plans to conduct outreach to business community about ageism. We already talked about ageism and how society makes an older person feel, that we're lost, we're not lost, we're dependable, we're mentally ill, we don't have good memories. It's just a host of things that we have to deal with when dealing with ageism. And our obstacles, the group is working through recommendations to verify the entity responsible, who's doing what, when is it going to be done, and how long is it going to take. So we're working on that, and that's going to, we know already that that's going to work out for us. We have an excellent group, an amazing group of folks. So that's my 2.5 cents.
So can we give another round of applause for the CART facilitators? The work they are doing is absolutely phenomenal. And again, these are just community members with good hearts, goodwill, and a little bit extra time that have decided to put their mark behind these recommendations. So we, again, if you have any questions at all, please write them on the index cards, and we will definitely get to that. But we're making some great time, and we're going to get you guys out of here in just a few more minutes. But I wanted to just say, you know, finally, I want to highlight a few of our community partners and organizations who are doing wonderful work. And, you know, Dr. Muhammad kind of beat me to it and shouted out RMAPI. He didn't know we were going to do this, but RMAPI needs to be shouted out. So Aqua Porter is right here in the audience for all of the great work they're going to do, that they're doing. I'm just going to talk about it a little bit, right? So you've already heard a little bit about formerly called the Anti-Racist Curriculum Project, now known as Our Local History, that's led by Shane Wiegand and Keisha James, and the phenomenal work that they're doing that was in partnership with the CARTs, and they are presenting their curriculum to all school districts across Monroe County with the exception of 2. So when we talk about this being a Monroe County issue and that the entirety of the county has to be involved, we're seeing that moving with our education. So we're hopeful that after this call, Brockport and Churchville will be calling them to get involved in this as well. You heard about the great work the Empire Justice Center is doing, leading the pretextual stops, and they've been doing trainings across the county as well, so we want to thank them. And you also heard Regina Bradley lift up the great work that's happening with the House of Mercy. So I'm just going to add a few more organizations to that. So definitely want to lift up our MAPI. They're doing phenomenal work at the legislative level, engaging our state delegation, moving housing priorities forward, and a slew of other things. But I do want to recognize the work that they did with their Level Up Challenge. So this was in 2021. Our MAPI embarked on the bold mission to raise the minimum wage for 10,000 Monroe County workers to at least $15 an hour. The RASE recommendations challenged the county to sign on to the Level Up Challenge because at the time, the county had not yet signed on, the city of Rochester had. And the county did it. So they raised their minimum wage. But our MAPI kept the momentum going and surpassed its goal. So through the Level Up initiative, more than 150 employers participated and increased their minimum wage to at least $15 an hour, and that benefited over 11,500 employees. So that was amazing work that our MAPI started to lead, the RAISE Commission was able to get behind and challenge. But that wasn't enough, because y'all know Aqua. She always got something else to do. So our MAPI continued advocating for a minimum wage increase at the state level, aiming to elevate living standards and reduce wage disparity. And in 2023, their collective efforts led to the successful passage of the RAISE the Wage Act, sponsored by our local assembly member Harry Bronson and widely supported by members of the local state delegation. So the RAISE the Wage Act is effective as of January 2024. It increased the minimum wage to $15 statewide, and it includes mechanisms for annual adjustments to the minimum wage to ensure that wage growth keeps pace with the cost of living. So it's indexed to inflation. So that is phenomenal. I also want to shout out our friends from Rock the Future. I know Brian was here earlier. I believe he had to leave, but Willie Robinson is still here, the Chief Operations Officer. And in direct response to the RAISE recommendation to develop strategies to increase access to mental health and social emotional support services for all Rochester City School District BIPOC students, in 2023, Rock the Future Alliance collaborated with the Pediatric Health Partnership, which is a collaboration of hospital systems and schools and community organizations and so forth. And they launched a new initiative that allows students to utilize telemedicine to access triage and assessments for acute care and chronic health issues, including mental health and follow-ups at school. So this resulted in increasing the number of school-based mental health sites from 8 to 12, and there's more to come. And it also provides telehealth services established currently in 10 RCSD schools. They're on track to add another 5, so that it will be 15 schools by the end of this year, with the ultimate goal of establishing services for all students in all RCSD schools. So kudos to Rock the Future for that great work. Give it up. You also heard a mention about UCLM, the United Christian Leadership Ministry. And I want to recognize the work that they have been doing. So in the past decade, under the leadership of Reverend Stewart, rest his soul, and Dr. Dwight Fowler, the members of the United Christian Leadership Ministry have been involved in the pursuit of the beloved community as drum majors for justice. But since the RASE Commission findings and the recommendations, UCLM has concentrated its primary work on police and community relations. They have set up regular meetings with RPD and the Monroe County Sheriff's Office to create better communication channels, as well as implemented MOUs related to information sharing and community participation in hiring process. In Brighton, with the leadership of Supervisor Bill Maley and Chief of Police David Catholdi, UCLM has helped to set up a community interview panel similar to what's in place at RPD to make the hiring process a more robust and inclusive system. So that means there's a panel that when new officers are in, they're being interviewed with community members at the table. And that was a recommendation of the RASE report. So UCLM is also in the forefront of the judicial observation process with input and member participation. So we want to recognize their great work as well. So please give it up for UCLM. And then finally, I'd like to recognize the Parent Leadership Training Institute, or PLTI, in direct response, again, to RASE Recommendation 2, which was to implement and incentivize practices and programs that increase the racial, ethnic diversity, and cultural competence of employees, vendors, and contractors. PLTI, led by Luva Alvarez at CCSI, has taken up the charge of a teacher diversity drive to elevate the representation of diverse instructors in Monroe County by leveraging parental engagement and fact-based decision-making. Through her efforts, PLTI has provided training opportunities for parents on hiring committees, increased opportunities for student voice to impact change, and continued a positive diversification of educators, beginning with the Greece Central School District. And she is looking to replicate her efforts throughout the county. So again, let's give it up for Luva Alvarez and PLTI. So these are just a few of the organizations that we wanted to spotlight tonight. We know that there are so many across the county that are engaging in this work of lifting up these recommendations. And it is our goal to make this as transparent to our community as possible, because we want people to know that there is an army of folks working behind the scenes on their behalf to make Monroe County more equitable and just for everyone. At your place, there is this bookmark. Hopefully you saw it. Dr. Green. I just want to recognize Thomas Green, who is the newly minted Dr. Green, as you hear us saying that. There's always room for more doctors, and I recognize that. So he did talk about the bookmark on the front and it talking about the charge. But on the back of it, it lists all of the carts, and there's also a QR code and website information. We encourage you to please get involved in the work that is being done. There is always room for one more. Your voices are needed at the table, and we encourage you to participate with any one of these carts or multiple of these carts, because they are doing great work, and we know that the work intersects. So they can't do this in a silo. We need more voices at the table. We need more voices of those who are most affected by these challenges that we're trying to overcome. We need the voices of experts in the field who can truly guide the work. We need the voices of you. So please, please, please join us. So we were able to get ahead of time. This was scheduled for 8 o'clock, but we might be able to give you a few minutes back in your evening. We definitely thank you for coming out this evening, choosing to spend your time with us, choosing to watch us live online. We'll see you back here again next March for our 4th annual community update, when we'll be able to let you know all of the wonderful things that we've done in this year, 2024. So thank you, thank you, thank you, everyone.